Let's begin. Let's begin. First and foremost, welcome to everybody. You may have met yourselves as you're waiting in the lobby. It's great to see you all this afternoon. Just to introduce myself, I'm Seamus Watson, a National Improvement Director with NHS England, and I've been involved with mental health going smoke-free pretty much since the outset, just over 10 years ago. It's been a great 10 years in many respects. We've made fantastic progress across our mental health community. What we're hoping to do this afternoon is to respond to some of the conversations that we've been having in our forums and in our local networks around some of the old and some of the new challenges we've got in terms of smoke-free mental health and vaping. We've had to change over the years because of the direction of travel, because of operational issues, including COVID, and in response to new policy and legislation. Next slide, please, Gemma. Okay, so what we're wanting to do this afternoon is very much engage in conversation and share as much as we can around some key areas that are current in mental health and its interface with vaping and going smoke-free. We'll be hearing in a minute from colleagues from ASH regarding a survey of policies and treatment services in the NHS. We'll be having an overview of the Tobacco and Vapes Environmental Protection Bill and regulations. We'll be picking up on disposable vaping and banning disposable vapes, vending machines equally, and disposal of vaping devices. So we're fairly busy 90 minutes ahead of us. We have allowed time for questions and conversation at the very end. We've got about 15 minutes for question and conversation, which I'm very much looking forward to. The meeting, just in terms of some of the housekeeping, the meeting will be recorded and transcribed. So we will have a copy for everybody at the end. If I can ask people to keep their microphones muted on silent, unless they're actually one of the speakers, and to use the chat facility. I'll be keeping an eye on comments, questions, queries, direction of conversation in our chat room. So by all means, use that chat facility as well, and we will pick that up when we have our questions and answers at the very end. Without saying anything else, it's really fantastic that we're joined again. This is our fourth, if not our fifth, webinar on smoke-free mental health. And on all previous occasions, as this afternoon, we've had national experts come along and join us and share that conversation that's happening nationally and the regional and more local experiences as well. I also know quite a few people on the call, and I know we've got some incredible experts and people with great experience on the call as well. So do share your experience this afternoon, and very much looking forward. Without saying any more, just if I could hand over to John, colleague John from ASH, to introduce himself and to pick up on our first area of interest, the finding from the ASH survey. Thank you, John.
Great. Thanks a lot, Seamus, for that introduction, and good to see so many people on the call today. Let me just try and share my slides. Can you see that? I can see nodding, so that's yes. Okay, great. So hi everyone, I think most of you probably know me. I definitely recognise a lot of the names on the call. I'm John Waldron, I'm Policy and Public Affairs Manager with Action on Smoking and Health, and we coordinate the Mental Health and Smoking Partnership, which is a coalition of organisations working to reduce smoking rates among people with mental health conditions. And I'm just going to give a quick overview of the findings from our recent survey of smoke-free policies and practice and tobacco treatment services in mental health trusts, which is a bit of a mouthful. We couldn't think of a shorter title. So just giving an overview of what the survey kind of was looking at. So it was a repeat of a similar survey we ran in 2019, looking at smoke-free policies, which is online if anyone wants to look at that. We had around 80% of mental health trusts in England responded, and it was carried out between October and December last year. So won't capture any changes that have happened kind of in this financial year. And the key focus was smoke-free policies, tobacco dependence treatment, vaping, and other kind of quit support and pharmacotherapy. And the key, just really top-line findings are Lots of services have rolled out tobacco dependence treatment services, but there are still challenges and gaps. Progress on smoke-free implementation is mixed. Vapes are playing a big role in services, and some of the key kind of enablers and barriers are leadership and how much priority is put on smoke-free in trusts, lack of resource and capacity, staff views, and culture. And I'm going to kind of dig into those a little bit more over the next few minutes. So just starting with tobacco dependence treatment treatment. So we found that 70% of mental health trusts now offer quick support to patients who smoke, which is really positive, but kind of coverage within that is quite mixed. So only 42% of trusts offer support to all patients who smoke. For the remainder, they're able to support some, but not all of their patients. And the reasons for that are constraints on funding, constraints on implementation, and challenges presented by delivering support in different wards. Patients are asked about their smoking status on admission, always or usually in around 80% of trusts, and then in almost 20%, service users are only asked about smoking on admission sometimes or rarely. So kind of a small but significant number of trusts where I think there's still a lot of work to do to improve the kind of support offered to patients. Around 40% of trusts offered ongoing support to patients on discharge from the tobacco dependence treatment service, which really highlights the importance of having an offer for patients when they transitioned into the community. And almost half of trusts offered stop smoking support to staff. So, considering the provision of stop smoking support back before the NHS long-term plan started rolling out back in 2019, there's been really significant progress in delivering a kind of comprehensive support offer to patients, but there are still some significant challenges, which I'll cover a little bit further on, and a lot more work to do. And this just gives you a kind of overview of the proportion of frontline staff in mental health settings that are trained in providing very brief advice on smoking cessation. So you can see that a small minority of trusts where all staff receive training, but then quite a sizable number where a minority or only around half of staff receive training on VBA. So still lots of work to do there. And then moving on to smoke-free policies, there's been relatively little change in smoke-free implementation since the last survey in 2019. So 85% of trusts reported that they had a policy in 24 compared to 82% in 2019. So kind of broad consistency there, and smoking was still permitted on site in 15% of trusts. So again, that kind of small but significant number of trusts where I think there's really a lot of work to do to kind of get smoking on the agenda. And around half of trusts reported that staff escorted patients to smoke every day, obviously contradicting NICE guidance, and Section 17 leave was used to facilitate smoking breaks in around a third of trusts, despite CQC guidance stating that this undermines smoke-free policies and the principles of the duty of care to protect health. And the real takeaway, I think, kind of looking at the results as a whole, was just how much variation there was across trusts. So you have some trusts where they don't have smoke-free policies and there's very little support for patients or staff who smoke, whereas there are lots of others where they've really been steaming ahead on rolling out tobacco treatment services. They've had smoke-free policy in place for years, and it's a real key priority for the leadership. And most trusts are somewhere in the middle of this, where they're doing their best they have smoke-free policies, they're doing the best to make sure they're enforced and provide support to smokers in difficult circumstances. And this just gives you an overview of in practice where how often smoking takes place in trusts. So you can see that one of the things we found with breaches to smoke-free policies are very common. So while smoking indoors has declined since our last survey, smoking on hospital grounds, it remains commonplace. You can see there around half of trusts saying that people smoke on hospital grounds every day. So still big challenges in enforcing these policies in trusts. So then moving on to vaping, kind of unsurprisingly, access to vaping products was seen as a really important way to support and facilitate smoke-free policies and help patients stay smoke-free during their stay.
You've muted yourself, John.
Apologies, I don't know how that happened. Did you just miss the vaping bit?
Just the vaping bit, John, please. Yeah, thank you.
Sorry, God. Been working remotely for years and still can't get it right. So vaping was a really important way to enable smoke-free policies. All trusts allowed people to use vapes. 65% of trusts allowed people to vape inside, but this was mostly in patient bedrooms rather than communal spaces. Almost 80% of trusts provided vapes for free, often only for a limited period due to funding constraints. And disposable vapes were the product used most often on mental health wards. So, kind of preparing and supporting trusts to manage that transition from disposable to reusable vapes when the ban comes in, should be a really key priority for the NHS. And the two main brands of vapes that were available on wards were eBurn and Vape Dinner Lady. And there's much more granular information in the full report if people want to look at that as well. And I'll put the link in the chat in a minute. Looking at medications, so all trusts offered smokers NRT, but relatively few offered other more effective stop smoking medications like varenicline, cytosine, and bupropion. Obviously, generic varenicline was removed from the market in 2021 and only reintroduced last year, so that has clearly caused a big drop in the number of trusts offering varenicline, but there's lots of work to do to increase the availability of these medications to people in smokers in mental health settings, because we know they're much more effective than NRT, and so it's quite concerning that this very vulnerable patient population is really not receiving these medications to the extent that we would want. And then looking at some of the barriers that people cited throughout the survey, and I think everyone on this call will recognize these. So staff attitudes and belief, lack of capacity, insufficient funding, and uncertainty about future funding, which is an ongoing challenge, lack of leadership, poorly enforced smoke-free policies, lack of training or willingness of staff to undertake training, inconsistent practice across wards, and storing tobacco on site were the key ones that came up. And I pulled out some of the quotes on staff attitudes just because I thought these were quite powerful. So, staff views, culture, own smoking habits, staff not implementing the policy, need to improve ownership and adherence in clinical teams, often told it's unfair or makes mental health worse, which we know is not the case. So that's staff repeating, old myths about smoking and mental health. People knowingly or unknowingly resist or sabotaging efforts to implement the service. Challenges with the kind of as staff leave, experienced staff leave and new staff come in, poor practice creeping back in, challenges with the lack of training people have pre-qualification on smoking cessation, which I'm sure will be familiar to everyone on this call. So these were some of the key challenges that came up. And then looking at the enablers, a lot of these are just the same as the challenges, but in reverse. So institutional support and leadership, funding, strong smoke-free policy, governance and messaging, commitment of the tobacco dependence treatment advisors, which has been absolutely key, engagement with wards and staff, information and resources, training and prescribing NRT, provision of vapes, staff and patient involvement in policy development came up quite a lot, which was really interesting. And then support from the ICB and partnerships with other local partners, so local authorities, academics, NGOs. And it was really encouraging to see trusts who were, really pushing and developing these partnerships locally. And then also networking and sharing of best practice among mental health trusts. And there was just one comment that I feel kind of illustrated all of that, and I'm not going to read it out because it's quite long, but it just quite nicely sums up that the areas that have made progress. You can see them ticking all of these boxes and really trying to develop a comprehensive approach to supporting their patients to quit smoking. So then moving on to the recommendations. So the top two are more aimed at government and the NHS because they're around providing secure funding for tobacco treatment services in mental health trusts, which for us is absolutely critical. And then producing national guidance to support healthcare settings to adapt to changes in the law, so around disposable vapes, vape vending machines, any potential vape-free legislation that comes in future, and just reduce that really significant variation in service delivery that we're seeing. But then the bottom three recommendations are more aimed at trusts and ICBs. So ensure comprehensive implementation of those tobacco treatment services is a priority for all staff. Improve access to evidence-based medications, so the whole range, varenicline, cytosine, NRT, vapes, and ensure that staff receive mandatory training to equip them to have these conversations and address misconceptions. And so just in conclusion, so there's been really good, well, broadly good progress on tobacco treatment service rollout, but this has been constrained by funding uncertainty, challenges with leadership, and challenges with organisational culture and staff attitudes. Most trusts do have smoke-free policies, and that's really encouraging, but there's not been much change since 2019. It seems like we're a little bit stuck in terms of progress. And there are still lots of challenges with enforcement and implementation, and a small minority of trusts that still have virtually nothing in place, which I think really does need to be a priority nationally to address that lack of provision. And vaping is playing a really important role, and more support is needed to ensure that trusts can continue to make vapes available to patients who smoke as legislation around disposables and vending machines comes in. But despite all of the challenges, and obviously there are always a lot of challenges when you're talking about delivering services at this scale, we found lots of enthusiasm and support for smoke-free policies and for helping service users to improve their health and well-being by quitting smoking, and lots of hope for the future as well. So I just wanted to end on a positive note there, and I've got some links to the full report and some of the kind of media coverage there that people are welcome to look at as well. So I'll stop talking now. Thank you very much.
Thanks very much, John. Very insightful view of the past 10 plus years in mental health going smoke free, and messages in there for us all, I think, about, yes, we've made progress, but we still have the challenge of making sure it's a priority in every organisation, in every service. Great to build on our strengths. It was lovely to see those positive things that are happening in mental health as well. John, we will come back to a lot of your presentation, I'm sure, in our question and answers. And just hand over to Deb now, please. Welcome, Debbie. Hi.
Hi, everybody. Hi, everyone on the call. I'm Debbie Robson. I'm a senior lecturer in tobacco harm reduction in the Addictions Department at King's College London. I'm a mental health nurse and I'm a trustee of ASH. So what we thought we'd do in this very brief part of the webinar is give you an overview and try and disentangle some of the misunderstanding about the new legislation and kind of what's on the horizon for us all. So we've got three different bits of legislation that are going to have an impact in mental health settings. We've got the environmental protection regulations that came in last year, but will be coming into force in a couple of months. And that's the single-use vape ban. We've got the tobacco and vapes bill that's gone through Parliament at the moment, and then we've got the vaping products tax. And in terms of what we need to consider for each bit of these legislation, so in terms of the single-use vape ban, is how our trust's going to transition from disposable to reusable devices, and how are you going to make sure that those new products that you're probably going to be using are safe, but just as importantly, effective at delivering nicotine, because some of the products trusts are providing at the moment are not that efficient at delivering nicotine. With the tobacco and the vapes bill, there's the consideration for those trusts that are still using vending machines. How are you going to supply vapes? And then in the future, because regulations will likely change around flavours, what flavours will you be allowed to supply? And also, where will people be able to vape? And then much further down the line, we need to think about the cost of vaping and the costs to trusts. So in terms of legislation that's already been passed, so the environmental protection regulations, that's been brought in by DEFRA and not the Department of Health. So that's going to ban the sale and supply of any single-use vapes from 1st of June this year. And then with the vaping products tax, which is going to increase the cost of e-liquids, but still make them much cheaper than tobacco smoking, that's coming into effect in October 2026. What's taken up a lot of conversation at the moment is the tobacco and vapes bill that's gone through Parliament at the moment. So you can see the tobacco and vapes bill as kind of two parts almost. So there's new proposed laws, which what we call is on the face of the bill, and there isn't any consultation about this because the consultation process has already happened. So these are things that trusts need to adapt rather than push back on at the moment. So that's things like the generational smoking ban and banning vaping and nicotine and non-nicotine products to under 18s. And the free distribution of these products with the exception of healthcare settings and stop smoking services. And this is part of the bill where the ban on vaping and nicotine product vending machines come in, as well as banning advertising. And these laws will come into effect 6 months after the bill receives royal assent, with the exception of the advertisement ban, which will come in a bit sooner. In terms of the other parts of the bill, which is essentially the government are going to give themselves powers to regulate things and adapt rules and regulations over time, but it won't mean that they delay things by needing to pass any new acts of Parliament. These things will require further consultation. And so this is where trusts can have influence to push back on. And the things that will affect trusts in the future is potentially if there's any restriction on vape flavours and extending smoke-free laws so that they include vape-free places. And where that is in the stage at the moment in Parliament, it's gone through the House of Commons, it's at the committee stage in the House of Lords. It then needs to go to the report stage and a final reading in the House of Lords. Then it gets passed back to the House of Commons, and there's everyone who's suggesting an amendment. It then goes back and forward between the House of Commons and House of Lords until finally it reaches royal assent and King Charles signs off on the process. So we're a little way off still of these laws and powers being granted. So for in terms of the vending machine ban, that's not going to come into place until 6 months after the bill reaches royal assent. So there's still plenty of time to get our heads around that. And then with the government powers, government will likely, but we don't know for definite, but they'll likely start consulting on the different powers once the bill receives royal assent. So in terms of timelines, we kind of got to get our act together around in terms of not using any single-use vapes from the 1st of June onwards. So this law was brought in, or the announcement of the law was brought in nearly 6 months ago now. So hospitals, retailers, everybody have had a almost 6 month sell-through period. The vending machine ban, the earliest it will come in will be at the end of this year. I can't see it being any earlier than that because, as I've just said, that will be coming into place 6 months after it reaches royal assent. So trusts can still sell reusable, rechargeable devices from vending machines until the vending machines are banned. And then we've got to get our head around in terms of coming together to push back around the vape-free spaces that could potentially come in the future. And then further down the line, we need to think about the cost. But alongside all this new legislation, there's never been more investment in tobacco dependence treatment as we've got today. So we've got an additional £70 million in local authority stop smoking services, and that money is supposed to be targeted at groups with high smoking prevalence. We've just had Swap to Stop extended for another year, so an extra £90 million invested, and again, that's to target people with high smoking prevalence. And mental health trusts across the country can make much better use of this scheme. We've got pregnancy incentives. What we're not clear about, and it would be, better to have some kind of further clarity on what's happening with the long-term funding. So I'm going to end there and pass you back over to John, who's going to lead a discussion about single-use vapes.
Thanks, Debbie. Let me just reshare my slides again. Hopefully people can see that. This will be very short and sweet. So I'm just going to set out a bit of detail about the disposable vape ban, which hopefully everyone is aware of and prepared for, and kind of some of the implications for services. So as everyone will know, single-use vapes are going to be banned from 1st of June, which is just a month away, which is it's coming up. And this means that any vapes legally on sale in Britain need to be rechargeable, refillable, and have a coil that can easily be replaced. So any vape that doesn't tick all three of those boxes, so if you get something which is rechargeable but not refillable, for example, or something where you can't replace the coil, will be illegal from 1st of June. And there are lots of, over the last kind of year or so since the ban was announced, lots of manufacturers have introduced new models which they're describing as reusable, but where you might not be able to replace the coil, or it might not actually be refillable. And so even though these products are described as reusable, some of them will be illegal under the new regulations. So those are the kind of three key boxes you need to watch out for in terms of making sure vapes are legitimate. And the ban covers both the sale and supply of disposable vapes, which means that healthcare settings and stop smoking services are covered the same way retailers are. So they have until the 1st of June to distribute any remaining stock. And following this point, it will be illegal to sell or supply disposable vapes to service users. And there are no exemptions to this for any settings or purposes. So I just want to be really crystal clear about that, so that people have clear expectations about what's coming. And so the key actions for services are to ensure any remaining stock is sold or distributed, dispose of any leftover stock safely, and vape retailers should offer a take-back service where they accept the return of vapes for recycling. So get in touch with your provider if you're not sure about this. And service users can continue using disposable vapes that they've purchased or been provided before the ban. So using them or possessing them is not illegal. So service users don't need to worry. It's just the sale and supply of vapes to people that will be illegal. And so you probably will have service users who have stocked up on disposables, who need to work their way through the stock they've got over June before like after the ban's introduced, but before they run out. So these products will still be around, but trusts need to make sure they're not providing them to people. And DEFRA has produced guidance on the ban, which the information I've just given is pulled from, and it's mainly aimed at businesses, but it does address the supply of vapes in healthcare, disposable vapes in healthcare settings. We wrote a blog, kind of disposable vape ban, what you need to know, which sets out kind of clearly in summary sets out the implications for services and what services need to do to prepare. And then next Wednesday we're holding a webinar specifically on the disposable vape ban, which will have case studies from trusts that have transitioned from disposable to reusable products, who will talk through that process, the challenges, how they've tried to address those challenges, and the kind of products that they're using. So hopefully that will help to inform trusts and give people a chance to kind of have a more in-depth discussion about how to adapt to the ban. And the link to register for that is there, and I'll put it in the chat as well, so anyone who hasn't already seen that has got it. But I think that's it, and happy to address any questions in the Q&A session at the end.
Thank you, John. Very, very precise, concise summary of where we're at there. Really helpful. Just handing back now to Debbie and Ogechi. Welcome again.
Hi, can you all hear me?
Yes.
Yes, great. Okay. Yeah, good afternoon, everyone. So I'm going to share my screen.
Ogechi, before we move on to that, should we just give people a bit of kind of context about the vaping and vending machine ban?
Yeah, sure.
It's not free. I think, can people see my slides?
Okay.
Can
They're not. They're not up at the moment, Debbie.
They're not up yet.
Okay. Are they up now?
Now they are.
Got them now. Yep.
Okay. So in terms of there's just to give people a bit of context, so a lot of the proposed laws in the tobacco and vapes bill are very much following successful tobacco control policies that were implemented to drive down smoking prevalence in young people who were smoking. And one of those one of the most kind of popular and effective ways to do that was to ban cigarette vending machines. And for those of you who remember, they were banned in 2011 because largely many vending machines were unsupervised, and it just made it much more easy to access cigarettes without any age verification. So the government were wanting to adopt this for vending machines. And the Department of Health and Social Care have estimated that there's probably around 11,000 vape vending machines in the UK, distributed by 60 different manufacturers. So most of them are in pubs, they're in kind of bars, they're in concert venues, they're in shops, but they're also in hospitals. And John's survey that he's just presented, the ASH survey, indicated 9 mental health trusts have got vaping vending machines, and the majority of those trusts are London trusts. So this again, this will come into law 6 months after the bill's signed off. So they relate to vaping vending machines from so a machine where vaping products are sold, but also nicotine products are sold, so pouches and things like that. But what it does exclude is licensed nicotine replacement therapy. You can sell licensed nicotine replacement therapy from vending machines. And some of the examples of the kind of helpful things about vending machines is that it supports tobacco harm reduction. So it's a way of increasing the accessibility of vaping products. It might improve compliance with smoke-free policies, although there's no research on this. It supports patient autonomy. And for those trusts that are cash-strapped, it passes the cost of tobacco dependence treatment onto the consumer. But some of the drawbacks of vending machines is they're only good as the products that you put in them. There's often what we hear is lack of clinical oversight about how much nicotine people are accessing and taking into their bodies. They're often not accompanied with behavioural support. And what we hear is, so I teach a lot of nursing students in London, and they're often telling me stories about coercion and bullying from other patients around vending machines. Another disadvantage is you are passing the cost of treatment onto a consumer, and there's nothing, I don't think there's anything else we do in the NHS where we expect patients to fund their own treatment, and that creates equity issues. So not all patients may be able to afford or safely use the products in the vending machine. So we know at least 9 trusts are grappling with what they do about making sure patients have access to vending machines. So East London are a trust that are transitioning at the moment, and Ogechi is going to share some slides now about what their trust are doing. Thanks a lot, Ogechi.
Thank you, Debbie. Sorry about that earlier. I was in a rush. So, hi everyone. I'm the Trust Tobacco Dependency Lead, Ogechi, at East London Foundation Trust. So I'm just going to use up 5 minutes of our transition period of the vapes, the vending machine, and plans moving forward, as Debbie has alluded to as well. So, let's see if this works. Can you all see my screen?
That's good, Ogechi. Yep,
Yep.
Nice and clear.
Okay.
Thank you.
So just an overview. So I think a big challenge with some of the mental health trusts can relate to is the accessibility and clinical monitoring of the type of vapes used on site in inpatient settings, and even transitioning the community. So some of the suggestions and feedback we got from staff and service users was to have a machine in hospital so that it's accessible, so away from the general public and away from young children as well. So we did a pilot up until recently from October 2023, and we found that there were no reported incidences relating to fire. So we we actually tested whether it was suitable in this setting, and it abided our compliance within what's considered a safe vape and what isn't. Staff satisfaction was extremely positive, and it reduced the pressure on ward staff in terms of escorting or providing vapes on shift, whether it was in 9 to 5 or outside 9 to 5 hours or on the weekends. And it also improved access for service users to have these, because it was at a relative cheap price. I think it was around £4 discounted. So this was helpful for people who didn't have leave, especially on the PQ ward, so the psychiatric intensive care wards, and also if wards had run out of stock, which Debbie has mentioned in the previous slide. We also saw that there were no violence and aggression incidents reported during this period of the pilot as well. So there was very much a lot of usage we saw within this vending machine as well. However, as we are aware of the ban, we are looking at we're still in the transitioning beginning phase, I would say, the teething phase of how we're going to make this work. But we know that the impact will pose significant risk and challenges. So that includes, the initial teething stages of potential and actual violence and aggression, challenges on the wards. So I've started having those conversations early with senior clinical leads, directors, in how we can have this transition phase to start and move smoothly. We're also going to start sending a comms trust-wide email and also a comms flyer to ensure the news of this transition period, and also to inform our service users as well of what this looks like moving forward. Sometimes with this kind of change, we will get resistance and pushback from service users as well. For the time being, we haven't used any disposables for a year and a half. So the product in there is a rechargeable one. It's called SKE Crystal by Venta, and this also ensures that service users have enough stock during this period. And allows us to plan efficiently. So each directorate, so ELFT is a wide trust, covers 5 different areas in London and in Bedford and Luton. So we will have a task and finish group, and also project update of how we're going and facilitating this. And also we're trying to look at maybe August, September. So this will allow time for suppliers to remove their machine and also find alternative ways for accessibility for services, for service users who have limited leave as well. In terms of vape usage and supply, so within the policy, rechargeable pods are permitted. And as I've mentioned, we have transitioned away from disposables since 2023. We do have current posters informing service users of legal pod devices within context, and also the forbidden illicit pod devices. So in ELF, we don't really encourage service users to have they call it juices, but the refillable where you can pour the liquid in, because we want to reduce any risk of tampering with devices. So we have a checklist, a criteria of what we consider is suitable within our environment. So we are currently using .pro, but we are going to review these products for next financial year as well, just in terms of cost and also in terms of what was more suitable and accessible for service users in the community as well. So they have given us, different service user groups have given us different types of vapes they would prefer, some that we cannot use because they are, affiliated with tobacco companies. So the plan for the future moving forward, we are currently in all our localities, within Northeast London and in Bedford and Luton, we have our Swap to Stop partnership. And hopefully this is something that is continued. It's good that it's being continued for another year so we can have as much stock available for service users. We also want to explore providing limited supply within our limited budget. If the budget is approved, then we can have some limited supply for service users to have access to this. And also to signpost service users to appropriate vapes via the policy and also by the posters. And also, if they are going into the community, to liaise with our community partners and in our in-house community clinics where we would have supplies as well for them to access. If they are, we do have cohort of service users who do not, necessarily want to abide by the hospital approved ones, then we can try and give them as much information, health information pertaining to the ones that is suitable for them as well. And that's my slides done. I'll hand back to John.
Thank you, Ogechi. John, back to yourself.
I think it's over to you, Seamus, actually.
Yeah, I think we've got Nathan next, Seamus.
Here we go. Well, thank you all. It's a fantastic update in terms of where we've been and what happened so far. Just to hand over to Nathan now, please. Welcome, Nathan.
Thank you very much. Thank you for having me on the call. I'm hoping that everyone can take away from today sort of a different spin, especially from the recycling sector. Vapes are very front end, and I think when you look at any waste, vapes as well, there is a whole back end recycling, that infrastructure that happens. And I think part of today's presentation that I'll share with you all is just showing you a little bit into what we do, in some problems, challenges, case studies that we've had. And it may just give you guys another view on that. Just give you a bit of background about who GAP are. So GAP are a UK based national recycling group. We were founded in 2005, so it's our 20th year anniversary this year. We're based in the heart of Gateshead, which is in the northeast of England, and we're a fully permitted, approved, authorised treatment facility. In terms of the scale of what we do, obviously vape recycling is one of our branches, but to give you guys an idea on the scale of our operation, is we are licensed to process 90,000 tons of electrical waste each year. So recycling electrical waste is our core business, but vapes was a bit of a spin-off to that, and it was an avenue which we only discovered back in 2021. We have all our ISO accreditations, or the 9001, 14001 and 45001, but we also have a dedicated vape processing facility now, in which we are actively processing vapes through methods which I will share with you later in the PowerPoint. So what is the current situation with vapes? Some of these figures are back from 2023, 2024. So in the UK, 7.7 million single-use vapes are sold each week. That number is decreasing slightly with the ban coming into place, but when it was at its pinnacle, 7.7 million individual units were sold each week in the UK. Now, that is how many were sold. About 5 million were thrown away or discarded through improper recycling methods. And if you took 5 million vapes each week, the lithium within the batteries, and you encapsulated that together across one whole year, you would have enough lithium to produce 5,000 electric cars. So just as a bit of a fact on the scale of how big this problem was to a recycler, and to the UK as a whole, it is quite shocking figures. It works out.
Hi Nathan, just sorry, I don't. Your slides aren't on the screen, by the way, just in case you're trying to share them.
Have I not shared my screen? My bad. Oh, thank you so much for pointing that out. I'm just
I wanted to flag before you got too far into it.
Yeah, absolutely. Sorry. There we go. Yeah, so sorry, going back to just to recap, the scale of what we do: 90,000 tons of electrical waste per year, based in the northeast of England, founded 2005. We moving in the right direction. Yeah. So 7.7 million vapes sold each week, which is about 5 million are thrown away. It works out at 8 vapes per second are being discarded through improper recycling methods. So when vapes came to market, sort of COVID times, I don't think there was enough infrastructure for the recycling of these things, and I think that's why when you're driving home, driving anywhere, you see these little blue lights flash up on the roads, and that is the vapes. Sources show that only 17% of vapes are actually recycled, which is a really small number. And I think there's many different efforts which need to be made to try and increase that. the illicit market is a massive part of vapes and vape smokers' health. So sources suggest that 50% of all vapes on the market are illicit vapes. If you look at all the health problems that people get through vaping and all the stories of people potentially getting, say, popcorn lung and things like that, it's probably because they were smoking an illicit device, unregulated high puff devices, when actually vaping is quite safe and is a good alternative for people. June the 1st ban, I think, has been mentioned a couple of times now. So as of the 1st of June, the single-use vapes will be banned. However, there is going to be, in our opinion, very mimicky-like products where they will have a small rechargeable port in a small refill. How much they actually get reused is yet to be seen, but at least it is better than just a single-use option. I just want to touch on this slightly, and we might go, oh well, why is vape such a big problem? There is a multitude of different problems from a recycling perspective, but one of the biggest ones is batteries. So the vapes contain lithium-ion batteries, which I'm sure you're all aware, and there is more and more demand nationwide. You've got electric vehicles being manufactured now. Batteries are becoming more and more. In 2022 to 2023, there was a 71% increase in battery fires in municipal waste vehicles. That is batteries going into black bin bag waste. They're getting compressed on the road, and that is then causing fires. There's no hard evidence to suggest, but you would probably think that some people are discarding vapes through black bin bag waste and therefore causing fires and such. They obviously cause problems to us as a recycler. We and most other recyclers do have small incidents on a weekly basis of fires, and 9 times out of 10 these are related to batteries being not going through the proper receptacles. And then there's the environmental concern as well, which is the toxic leaching and the harmful but also rare earth metals not being recycled and put back in industry, but are just making their way into ground and contaminating our environment. So how do we as a company actually recycle vapes? Well, as I've mentioned earlier, we have a dedicated vape recycling facility. And I'll just talk you very briefly through our process, but it is literally as simple as this slide, and it is a very manual process. So we offer a nationwide collection service for vapes. When the vapes reach us back in Gateshead, we then sort them into batches. Once they're sorted into batches, we then process them in those batches. If the guys are taking apart vapes, it's easier for them to get into a rhythm of doing the same brand, same style of vape over and over again, and it improves efficiency. And then the dismantling part of it is literally as simple as a pair of pliers in your hands. There is no automated method for recycling vapes as yet. And then what we do once we've dismantled the vape, we send the various components to the down the right recycling methods. So the plastics and metals are actually processed with our generic waste electronics here at Gap. The batteries are sent to an approved battery treatment operator, and the only part which can't be recycled within the vape is the nicotine and the nicotine filter, and therefore that has to go through incineration process. To give a scale on how many vapes we've done, I'll leave that for now, and I'll come back onto that in a later one. So we did a bit of R&D because we thought, oh well, if we're dismantling vapes by hand constantly, there's got to be someone who's going to come to the market first with an automated solution. So very early days of recycling vapes, we did do some R&D, and we figured out this press. So this press can hold 5 vapes. Or we had to put the vapes in upside down. It would press through the vapes, and then it would eject the contents of the vapes through the bottom of the press. Now we thought this was great. It mitigated the likelihood of workers' RSI, and initially there was a 30% increase in efficiency. As we've gone on with vapes, we've found some problems with this. So we are actually probably more efficient than the press just doing it by hand. There is a significant initial investment required to put that press in place. And that press there that I've just videoed is for a Vuse Go single-use vape, which is one brand, one style of vape. Because of the margins and the engineering behind this press, you would have to have custom manufacturing for each different brand style of vape, which I think you can all appreciate how many vapes, styles, brands there are within the market. We do get a lot of pre-consumer vapes as well, so from the likes of Trade and Standards, which require deboxing. So we thought, oh well, can we debox them? Can we debox them at least? So the second video here shows us at a recycling site looking at a depackaging machine, and there you go. You can see that a fire occurred. I think someone has got their microphone off mute, and I can hear a bit of thing in the background. So if people could mute, that would be brilliant. Just skim past this as well. So why can't we automate? We might go, oh, well, it costs a fortune to recycle vapes by hand. Why can't you just put in a shredder and shred them? Well, obviously we can't shred batteries because of the fire risk. There is massive potential for automation, which would result in the recycling costs reducing, and it would lower the risks of fires and whatnot. But with the ban coming in, and from a commercial perspective, you can't expect a recycler to put a lot of money in looking at a vape recycling plant when we don't know if the feedstock or the amount of vapes in the market is still going to be the same after June the 1st. This is personally something that we are looking at and we are reviewing. And once the ban comes into play and we see what the volumes are doing, then we may go down that again. And I should emphasize on the fact that there is no company in the UK recycling vapes through automation. They are all hand dismantled or incinerated, which incineration is again, you can't incinerate vapes either. They have to be hand dismantled. Some recycling stats back here from us in particular from 2024. You can see collections increasing month on month. These are actually last year's figures. I can say for certain that there is 40,000 vapes roughly in a ton. We recycled 60 tons last year. So 60 times 40, we did 2.4 million individual units by hand last year, roughly there or thereabouts. From perspective of how much work that was, each guy or each labourer that we have can do 120 vapes per hour. So you can imagine the amount of time that we spend dismantling these vapes, and it's sort of it will never catch up to the demand of vapes which are on the market, but at least we're playing our bit and doing the right thing. We have over 1,500 containers out on collection sites. I'll come on to that in another slide. And what we are seeing, being electrical waste recyclers, we collect a lot of waste from household waste recovery centres. In certain recovery centres, we're seeing a really increased amount of vapes coming from certain areas, and we believe that is possibly trade, retailers, people who are selling vapes, albeit they are recycling them, but rather than paying for the recycling, they are just taking them to the household waste sites and recycling them that way, which is something which we are trying to police, but is really hard. So what is our vape service? So we have various containers available. We have a national collection service, including the Northern Ireland. We do not cover the Scottish Islands. However, that is something that we are looking to progress with. We offer a 10 working day collection. So after your request is put forward, we will ensure that your bin, container, receptacle is collected within 10 working days. And these are some of just the various containers that we do. So smaller boxes through to drums, through to sort of really aesthetic looking tubes, which are quite popular. And some of the people that we are working with at the minute are the likes of vape retailers, Totally Wicked, Phoenix to Retail. We're working with service stations, BP, Ascona Group, construction industry, Kia Homes, Bovis Homes, Northeast Trading Standards. They're just a few of our current partners that we do work with. Penultimate slide. John mentioned that this would be a good thing to talk about. So just want to talk about this little case study that we did for Greater Manchester Mental Health Trust. This is only recent. We only rolled out containers to them sort of 2 months ago. So they wanted a solution because for people vaping on the wards and or vaping around the NHS premises, they wanted somewhere for the patients to be able to drop in their spent vapes. So we offered them the tubes. I think we distributed 41 tubes for them to space across the wards. And then we also distributed to them 20 of the blue barrels, so that on an evening they could decant the vapes into the barrel for safe storage. All of this comes with the support and paperwork, the correct collection notes, and whatnot. If anyone is interested in that service. What do we believe as a recycler is the future of vapes? Well, vapes actually can be recycled. I've just spent the last 10-15 minutes talking about how vapes can be recycled and how well they can be recycled. There's the potential to reduce the amount of virgin plastic and virgin rare earth metals being used in new products. There is talks of UK-wide curbside collections by 2026. So like you've got your general waste bin, your recycling bin, there may be a caddy in one of those bins where you can put your electrical waste, your we call it the drawer of doom, where you've got a little drawer in your house that is full of cables and whatnot to try and encourage stuff like that. And vapes would fall into that category. But how do we get there? Well, it's the government must participate nationally and locally, putting out campaigns and things and whatnot. Businesses play a crucial role in getting the message across, doing things like what I'm doing today. But ultimately, the public need to be advised and they need to be guided in the right direction, that recycling is a priority. We worked with the prison service sort of last year, and we did a bit of R&D with them. In the prisons, they smoke reusable devices, but as pictured in the slide here, you can see it's a sort of a single-use pre-filled pod, clear, of course, to stop any contraband. So we took they produced hundreds. You can imagine the amount of prisoners smoke and vapes, because tobacco is not allowed in prisons anymore. So you can imagine the volume of these that were coming through the prisons, all just single use. So we took some of that, we shredded it down into the second photo, and we washed it. And then what we were able to do is take that polycarbonate and then remanufacture it into cutlery, which is again used in the prison. So that is just one small little case study where we've done a closed loop of recycling and turned what was a waste back into a product. But ultimately, I hope today has given you enough of a sort of at least a different view, or you take something away from it today. And yeah, happy to answer any questions at the end as well. I am contactable via email, and if you scan the QR code, then you will be able to obtain my information to get in touch as well. So thank you for the opportunity, and I hope you'll enjoyed it. Thank you.
Thank you, Nathan. Very, very, very much enjoyed it, and some fantastic insights into your unique world of recycling vapes. And I'm really struck by the volume that you deal with sort of week in, week out. The other quite striking feature is, for me, is the wider implications around going green and being environmentally friendly, and that critical role that you play and we play when we come alongside vaping and going smoke free. Thank you, Nathan. Really, really interesting. At this point, we have got time just to pause and to again thank Debbie, John, Nathan, and Ogechi for the presentations, and to invite questions or comments. At this point, just I'd like to open it to the floor, to the meeting. If you could just briefly say who you are and ask your question. Gregory, welcome.
Hi, my name's Greg Downwell. I'm the Treat Tobacco Dependency Lead for Pennine Care Mental Health Trust. A very, very simple one. You're probably going to be doing it anyway. Can we get access to all the slides that we've shown today? Because some very interesting information that I could really use to take back to my organisation for information, particularly the stuff about the gear that you're doing, Nathan, because we've had a hard no on using all of those products. So I'm very interested that that's in use. And get some more contact details off you. A quick question: how do you pick the used vapes up and get them to you?
So we use an approved waste collection third party who are actually a battery collection service, but as a spin-off on what we do with the work with them, they travel up and down the country collecting the vapes. Now, they don't actually remove the containers from the sites. What they do is they go and they decant them into their own. So it's basically like emptying your recycling bin at home. We'll arrive within 10 working days. We'll decant the container, we'll leave you with the containers because ultimately they're yours. And then they make their way back to us. And at the time of collection as well, we get a electronic signature from whoever they've been collected from, and then that information is then fed back through via email with support and paperwork.
But that paperwork, that's all the weights and measures of everything that you're taking away on each time.
Yeah.
And the other query I've got is that, because I know that a lot of the companies that we've been looking at, and Dinner Lady, for example, they all use DPD to transport from us back into their own recycling. And we have great difficulties with getting DPD to release their license, their hazardous hazmat licenses. They just keep telling us it's online, and not disparaging DPD, but when you go on, you can't actually find DPD on the government website. So the organisation that you use, is it registered on the government website?
Yeah.
So we can go for it.
Yeah, so I can supply certificates of waste carriers licenses.
Yeah.
And like I say, their bread and butter is carrying batteries around, so vapes to them is a form of battery. So yeah, more than happy to share any of that information with you.
Then outside of here, I'll get you in touch with our waste guys, and we'll pick up a conversation if we can.
Yep, brilliant. Sounds good.
Cheers. Thank you. And thank you to everyone else. It's been great.
Thank you, Nathan. Thank you. And Gregory, before you fly, yes, we will be distributing all of our presentations and a transcription and recording of the webinar. So it will be available. If you give me a few days, I should have it with you early next week. So copy of the presentations, the webinar and transcription as well, Greg.
Yeah, thank you very much.
Good to see you. Hi. Good afternoon, Darren.
Hi, sorry, Seamus, my laptop's a bit of a nightmare today. Yeah, I'm Darren. I'm the Tobacco Dependency Treatment Service Team Manager at Tuve in the Northeast. It was just a quick question again for Nathan. Nathan, do those the recycling tubes that you have on the Manchester wards, are they lockable?
They aren't necessarily. They're not lockable, no. But however, could a lock be retrofitted to one? I would say so, yes.
Right. Okay, right. Thanks.
But happy to take this offline if we can work on sort of a bespoke solution if needs be.
I think it's just about from a mental health background. It's just about where we would site stuff like that, just so it was safe. So I've got your contact details. I'll get in touch. That's great.
Tremendous.
Thanks.
Thank you, Darren. Nathan, good to see you again, Darren. Take care. We had Nikki, I think, earlier on.
Hi, yeah, I did have my hand up, and then I realised that probably I can take it offline and go straight to Nathan. But thanks to everyone else for the presentations. It's been really useful to kind of see it. I'm tobacco control practitioner in Buckinghamshire Council, so I'm not mental health focused, but it's just been really good to kind of get back into that and hear and see it all again. So thank you very much.
Very welcome, Nikki. And your background as being a county council member, we all know the future isn't just within the NHS, the future is with our system partners like yourselves and the county council and Nathan, who's all involved with disposal and recycling. Great you could join this afternoon, Nikki. Good to see you.
Thank you.
Any other questions or comments people had on what's been a fairly wide-ranging discussion about where we're coming from, some of our imminent challenges and some solutions in there as well? Nope. Okay, so what I'll try and do is summarize. Just listening to all of our presentations, it feels like we have continued to make progress in terms of mental health going smoke-free, but we still have a way to go as well. It is concerning that we seem to have frozen progress around 2019. So there's a challenge in there for us all, I think, about returning to what we've learned in getting to our stage in 2019, but what do we do next? And just from my experience and from listening and talking with people, a lot of that's been said already this afternoon. A lot of that is about leadership. It's about it becoming a priority. It's perhaps about returning to the fundamentals of why it is we were going smoke-free in the first place. And some of those fundamentals 12 years ago are just as true now as they were 12 years ago. The whole thing we know about tobacco being the single biggest cause of premature ill health and mortality, and especially so for people with severe mental illness. We know tobacco dependency creates something that looks like anxiety, agitation, and we try to look after people who present with anxiety and agitation. So it would make great sense for us to support people in not smoking. We are also often reminded that smoking is often the things that makes people end up in poverty. It's one of those things that trips people into poverty. People who can ill afford to smoke end up smoking and end up in that poverty trap as well. And certainly the final thing we talked about many years ago when we were making this a national priority was the whole thing about valuing life. And we have to value all our lives equally. And if we have people in our society, in our communities who are dying early because of smoking, we have to do something about it. A hand went up briefly. Well, did somebody want to add a question or a comment?
Hiya. Yes, thank
Sarah,
you,
welcome.
Seamus. Yeah, sorry, I was a little bit slow with getting my hand up before you went into your summary, so apologies about that. I was really intrigued by a number of the statistics that John shared with us from the survey, particularly, I think, the 65% of trusts allowing vaping inside and in patients' bedrooms. And we're quite early as an organisation in our smoke-free journey. And the position that we've taken at the moment is, outside only. So I'm really interested if there's people that are a little bit more mature in their smoke-free and what their experiences are of allowing patients to vape inside and also not allowing it. So I'd just be keen to hear a bit more from other providers around that aspect, please.
Is that something you could respond to, John or Debbie? Is that something that has come across in your surveys or in your work?
So definitely, I mean, as Sarah highlights, it was one of the quite notable things in the survey that there were, I think, more trusts than we expected, who allowed vaping inside rather than just outside. But yeah, I mean, I'd be interested to hear perspectives from, as Sarah said, from other people working in these settings who may be allowing vapes inside.
Yeah. Thank you, John. Ogechi.
So I can say from the beginning when I joined ELF 6 years ago, it wasn't a conversation around vaping indoors, but I think as time and more information went by, it's all down to risk assessment, and there'll be some areas like I could say in Hackney, in the downstairs on the wards, they have gardens so they can vape outside. And on mother and baby units, they wouldn't be allowed to vape unless they're in the garden. So it just depends about areas of access and also if the areas are properly ventilated. So we normally say make sure that the windows, I know they don't go very far, but to keep them open, but also for those who are vaping, we try and tell them to vape outside so that it's better for the recipients and staff don't inhale things that they're not supposed to. Because I think the biggest misconception is that although vaping is an alternative, it's still trapping bacterial particles in the air, and people are inhaling it. And there are some studies coming out, early studies, I would say, around secondhand exposure to vaping. That's still not, the mechanism is still not well understood, but it is important for staff to social distance and encourage service users to vape in areas that are properly ventilated as well.
Thank you, Ogechi. Thank you. Linda, welcome. Good to see you. Hi.
No, apologies, I was very late, so I will watch the recordings, but I had to be in something else, so thank you. I guess from our point of view, we have our acute wards and our older adult, and then we have our forensic services. And I guess in our adult services, that's been, and we moved to vaping at slightly different, well, quite different times actually. So we had vaping in our forensic wards kind of a lot earlier. So that initially was kind of brought in a time ago, and vaping was allowed indoors as well as outside. And I guess, and the adult wards kind of have brought it in and gone for more of a so secondary mental health, more of an outside route. And some of that's been because their gardens are open. It's very easy for people to use vapes how you're expected to use vapes, with it being outside. And I guess one of the challenges we've found, and why we're trying to balance that with being able to vape inside, is because we're kind of really keen to not have to get back to that sort of dominant feature of, because our gardens are supervised and they're not suitable for being able to make safe without a level of supervision for our forensic wards. So many of those wards are supervised access to the gardens, and we just didn't want to get back into that kind of, that supervised, that's where everything comes down to kind of, can we go in the garden, what time are we going in the garden, and then kind of having to have time so that people know when they can go out or when they're not, and just, I guess, the resource implications and the kind of whole, if it's going to be outside, how, if they have them on them, then it wouldn't be. So we have had it inside. I think there is a little bit of well, there's a conversation being had in terms of, I think it would be many people would want it to be outside, because that sort of just, if it can be outside, it solves many issues also from our sort of fire departments and things like that. But we're kind of trying to balance that with that becoming, we don't want to go back to those ideas of smoking times, and it just dominates so much of the kind of day and the conversation. We really don't want to get back to that and allow people to sort of use them in a, graze on them, how they're sort of meant to use vapes, rather than these sort of short bursts. So that we're in very much that debate. So I'm really keen to also hear what other people are doing, because.
Thanks, Linda. And I think quite a few people in a similar space to you. So it's great to hear and to connect with what's happening around us as well. Ogechi, did you want to come in there as well?
Yeah, I just wanted to say to Linda, I perfectly understand, especially forensics, it can be very challenging supervising those times. I think something that's worked well is trying to get service users. I think the wards and the staff have tried to get service users to have a routine. And I know that's very difficult to do and implement in secure units, especially medium secure units. But I found that working with some of the lead nurses, I found that it works well in the low secure units when you include service users in the conversation. So having a service user led approach, as okay, I always tell the service users that I have assessments with that I don't smoke. Tell me what works best for you. So it's revisiting that person-centered care approach and doing a little pilot, and then feeding that back. So feeding that back qualitatively, or even doing a QI project also helps cement that evidence base, because sometimes in this kind of specialty we work in, it's very hard to say, oh, this works, but there's no evidence. We rely primarily on quantitative findings. So I think having that qualitative side will also help facilitate that, and then also looking at ways to improve service user, so service user improvement. So I think that's one area to explore if if you want any ideas, I can touch base with you outside of the meeting as well. That's just something I thought to pick up on.
That's really helpful. Yeah, I think it has. That's where we kind of had got to with the single-use vapes. It was very much led with individual patient communities about how and where and what, and that, you know, can change with the community, and kind of also sort of them managing it. I think there's sort of this bit more of a push for being outside, which is very much not what the patient group would like, and so we kind of is trying to work with that, but that also, yeah, kind of being clear that there is a real need for that if we are going down that route.
Thank you, Ogechi and Linda. Debbie.
Just continuing the conversation about second-hand exposure. So I've just put a couple of resources in the chat. So one is the OHID review on vaping that we published in 2022, that where we included second-hand exposure in that review on the health effects of vaping, and also we updated that for the Royal College of Physicians review on health effects of vaping published last year. So across those two reports, we identified 9 studies of second-hand exposure. They were mostly acute to short-term studies, and so what we saw was second-hand exposure to vaping was much less harmful and impactful on the bodies of passive vapers than passive smokers. But what there isn't any research on is long-term exposure around passive vaping amongst people on mental health wards. So it's something that we've tried to get funding for, to research the impact of second-hand vaping on staff in mental health hospitals, but we haven't been successful yet, but it's something that we're continuing to look for funding for. But short-term exposure isn't of concern as it is with second-hand smoking. And I agree with Adam's point in terms of there's no side stream vape, and yeah.
Thank you, Debbie, and a very helpful summary of where we are now in terms of evidence and short-term exposure to vaping as well. Thank you. Denise, welcome, Denise. Hi.
Hi, I'm interested in the whole thing around not staff not escorting patients. We are doing that. We're not in that we've brought in that they're not to escort patients to smoke. However, for us, that's come with incidents of violence and aggression directly. So we have seen an increase in incidents where leave's not been given, where, you know, consultants are under increased pressure for unescorted leave. Mindful, there's, you know, we've seen a PFD around an incident that happened around that, and how you know, those that are doing it that don't feel necessarily there's been an increase in violence, what are they doing that has supported it to come in without that reaction? I'd be really interested in that, because obviously we want to support our staff.
Yeah. So something I've just to share some of the things I hear. It's often about sort of the relationship. It's relational, the relationship you have with the service user and their family and people around them. Sometimes it's been about skills and confidence to de-escalate and to wrap around somebody who's becoming frustrated or becoming quite unwell. So as practitioners, it's not the complete solution, but I often hear people say it's people who don't feel very comfortable in having that type of conversation and find it very difficult. Staff who find it quite difficult, and remind well in having that type of, not confrontation, that type of challenging discussion about vaping and time for vaping and space for vaping as well. So for me, not to undervalue the need to be supporting staff who are on the front line having these conversations about vaping and where it can take place. Chris.
Thanks, Seamus. Yeah, I just wanted to take the opportunity to raise a point about swap to stop, if that's all right.
Yeah, of course.
Great. So I'm a project manager for TTD at Dorset Healthcare, so mental health inpatients, and we've been using vapes for several years to great effect. We've been really fortunate that our public health team in Dorset have been really supportive of us in accessing swap to stop and furthering that offer as well. But we've come to the point now where they're not going to be able to supplement that, so we can only access the swap to stop offer, through which we've come to the conclusion that there's now inequality because our patients are only able to access 4 weeks supply because of the need to provide a pod type device. Because of the risk associated with a tank type device. So in the community, they can get 12 weeks worth, but our patients who obviously struggle much more with smoking and suffer much more from its consequences are only able to access a third of that. So I've raised it with the Department of Health and Social Care, but yeah, I just thought it'd be a good place to raise it here and wondered if anybody had any thoughts or anybody could, again, have discussions with the NHSE as well. Thank you.
Thank you, Chris. And I've got this reminder of the money you talked about earlier on, Debbie. Was it 72 million of additional investment is around us, but perhaps not immediately in trust, but there is extra funding around?
For swap to stop, for the procurement process, is 19 million in the next financial year. And then for community services, it's an extra 70 million. And then you've got the long-term plan money, which Paul mentioned is kind of ICB responsibility now. But I wasn't aware that it was just a 4-week limit for your clients, Chris.
Yeah, I think it amounts to £40 so per user. So because of the difference in the device that we're using, it ends up being 4 weeks worth, and we can't find anything that's sort of longer than that, in terms of what we can get for the £40.
That's certainly something I'm happy to get involved in kind of discussions.
Fantastic. Thanks, Debbie.
It's not a good thing, is it, really? 4 weeks worth of replacement.
It's not. Paul, welcome. Good to see you, Paul.
Not at all. Chris, I'm Paul Chillicourt. I work for NHS England and I work very closely with the DH. I talk to them on a weekly basis. So I'll put my email into the chat. Please do send me on the information because I'm not au fait with the depth of the detail, and I'm happily raise it with them as well.
Fantastic. Thanks, Paul.
Thank you, Paul. And it's absolutely it's lovely to see solutions coming from a discussion as well. It's really quite warming for me. Gary, good to see you. Hi.
Hi, I was just going to come in around the kind of swap to stop because we are getting 12 weeks, but I'm wondering now, Chris, if it's down to the device that you're using. We're moving over to refillable devices because we've used them. We've not had any issues with them at all. And so we're moving over to them because they're much cheaper and we're going to get a 12-week supply. I think probably my question is, I'm being asked to report to the local authorities, back to the local authorities, and I've got 8 local authorities, so I'm going to have to report back to the local authorities. But I was slightly concerned about double reporting. I have actually just sent Ogechi an email because I'm worried about double reporting, because we'll still be submitting our data with our obviously quits and people who are reaching 4-week quits. But then if I'm giving that data to the local authority as well, is that not classed as a double reporting?
I think it is classed as double reporting, Kerry. I mean, that's something I can pick up. So we're just leading on the national evaluation of the extra £70 million investment a year in the local authority stop smoking services. So their quit date set and quit rates is something that we have to report back to DHSC. So it is something I'll raise. So that's a really good point.
Okay, that's
and I'm just thinking that might be part of your conversation as well, Paul, in terms of your engagement, your regular engagement of DHSC. Final
yes,
question.
and I suspect Kerry's double reporting to my data collection as well as the DHSE data collection. So that we know that does happen, and it's kind of an issue that we're having to live with at the moment without there being a single IT solution, unfortunately.
Thank you, Paul. Final question, Tracy. Good to see you. Welcome.
Hi, thank you. So I'm Tracy Sutton from Lancashire and South Cumbria NHS Foundation Trust. Again, it's the Swap to Stop scheme. So we applied initially to the Swap to Stop scheme. However, we've got some resistance from our directors of public health and 2 local authorities of the 3, which means that they're not really wanting to sign off because of their vape stance. And I just wondered if there was any support from the group or anyone that I could work with on that, because obviously it's a huge investment and it feels like not right that we can't apply on that basis, really. So it was just any support, anybody, or if anyone's in the same boat.
Yeah, and you said something, Tracy, about a vape stance. So people
so it's around their position around the position statement, and
okay.
for 2 of the local authorities out of the 3. So I feel like there's this resistance, and last time obviously it timed out. But we would like to apply again, but I feel like we'll go through that process, and then when it gets to the public health department, it doesn't seem to get any further. So it was just any suggestions of how we can resolve that, or if we can't, then we won't look into it. But it seems a real shame for our service users.
Yeah, is that something I could perhaps ask sort of John and Debbie to think through with your wide national view and your wide national engagement, just to think about Tracy's challenge there of somebody's taking a particular stance that makes it difficult to progress with your smoke-free work.
I think given that we would normally liaise really strongly with the ICB as well, and that post is now gone, so I don't really feel like I've got a connection that I had as well in terms of support from the ICB. So it'd be great if anything you can offer, that'd be great.
We can do that, Tracy.
Thank
Good
you
to see you. Thank you.
Seamus, can I just come in? Because we've got 8 local authorities and I'm only doing it with 1, and it's only 1 director of public health that needs to sign it off. So I'm doing it with Newcastle. They've had to go out to all the tobacco commissioners, but it's the 1 department. I'll get the words out. Director of public health that has to sign it.
So we approached 1 who was proactive in wanting to, but actually then they didn't want to disrupt this position statement that they're struggling with anyway. So it just kind of came to nothing. I feel like I haven't got that on my own to try and fight, if that makes sense. So it's a system-wide thing, isn't it? And yeah. So that was the plan, Kerry, but they weren't for taking that on themselves without their colleagues basically signing into that. So
thanks, Tracy.
Sorry, Seamus. There's just long-standing problems and challenges within the Northwest in a couple of local authorities that are quite historical. So yeah, happy to try and support, and sure Ash will with anything we can, Tracy.
Happy to support. But yeah, it's where certain local authorities have position statements they've signed up to on vaping. It obviously is challenging when you have to go through those to get onto the scheme.
Thank you, and thanks for your offer of support, John and Debbie. First and foremost, to thank again. I think it's been, for me, and hopefully for people who've joined us, a very intriguing, interesting, rewarding 90 minutes, just capturing up on where we are with our new challenges that we've got around single-use vaping, challenges around vending machines, and perhaps moving towards vape-free areas as well. We've got to almost continue all of our work we've been doing and take on board these additional positive challenges that we've got around us in terms of single-use vaping, vending machines, and potentially moving towards vape-free zones. Just finally to thank you all for joining us today. I think it's been really interesting, really rewarding. I would ask you to stay connected. I think this can be a difficult place to be if you're by yourself. So stay connected with people in your region. And we've had a reminder already that region isn't just NHS region, it's people in our local authorities, in the non-statutory services, it's our service user groups as well. So stay connected with each other. I will be circulating our presentations and transcription of this afternoon. I will share it. There are contact details in there, so do feel free to contact people if you want to talk through more or if you want to connect beyond your immediate region. Finally, to say thank you. Enjoy the rest of your day. It's certainly beautiful down here in Sussex. Good to see you all again. Take care.